You are watching the Doctalk show.
Bilharzia is an important cause of a dreadful symptom such as vomiting blood. So I want to understand what exactly is this bilharzia, which people could be at risk of getting bilharzia that might predispose them at some stage later in their lives to vomit out blood, which is mind you, is a very, very distressful symptom. Depending on the size of the injury, someone can vomit as much as, I don't know how many liters with it, can vomit a very, very large amount of blood. So this is a very life-threatening symptom, and bilharzia is an important cause of vomiting blood. So with me in the studio is our gastroenterologist to help us understand more about bilharzia. So Dr. Betty,
So,
before we went for the break, we explained it's a worm infection.
yes.
How exactly does this worm cause this vomiting blood?
So this worm, once someone has it, this person passes the eggs in stool, the type that causes vomiting blood, lives is transmitted by passing of the eggs in feces, not the urinary one. Yes, it's the one that is passed through stool. So the eggs actually hatch in water. They have a life cycle through snails, freshwater snails. Yes, part of its life cycle happens in the snail, freshwater
that
snail.
worm.
Then the snail releases again other larvae. Now, once someone steps in water or drinks water that has larvae, these larvae, most times they will penetrate the skin and then go through different tissues, eventually getting to the digestive system.
System.
Yes,
So,
into the digestive system, and then within the digestive system, these larvae develop, and then the worms can actually pass through the wall into the blood vessels where the adult worms live.
okay.
Yes.
So, maybe just to take you back a little bit, so you're saying it starts from someone who already has the worms within them,
Yes.
the schistosoma
So in the
worms.
life cycle, of course, the person with the worm passes, and anyone else could eventually get infected.
Okay.
Yes.
So
But
someone
someone
who
who
is
is
sick
infected, yes, yes,
will pass the eggs of the worms
in
in the
stool,
stool or in the feces.
yes,
And if that person did not use proper latrines, if they went to the bush
yes,
or they went to some
or
river,
to the water,
and
yes,
somehow those eggs found their way to the water. You know, the worms love to live in water. So the eggs hatch in the water and become some a form of larvae, or they're like immature worms, and these enter
the snail,
they enter the snails.
yes,
So after the snails, they again come out as another form
another
of
form,
larvae,
yeah,
which attack the
the
humans. They attack
humans.
people. So that is sort of the life cycle of these worms. For someone who is infected, passing the eggs in the stool finds its way to the water. They mature into some larvae that infect snails, and then after they come out as a second version of small larvae that will affect
Humans,
the humans.
yes.
So when these worms, these larvae enter the body, they will migrate and find a way
They find their way
somewhere towards the liver,
yes, into the blood vessels.
into the blood vessels.
Yes, but remember we said that the blood vessels that drain, that come from the intestines, all join and pass through the liver.
Okay, from
Yes.
the
So
digestive
so the
system.
worms will live in these blood vessels that are close to the intestines, and then they lay eggs within the blood vessels.
Okay.
Yes. So even while they're in the blood vessels, they continue to lay eggs. Yes. Of course, the eggs within the blood vessels may not be shed into the stool because they're in blood vessels. So the eggs are transported in blood up to the point where this blood vessel enters the liver.
Okay.
Yes.
So
And
they like to stay
they
in the
like,
blood vessels of the intestines.
yes,
They produce eggs which are deposited in
yes.
the
So the eggs will move with the blood,
and
and
they enter
where the
the
blood
main
vessel
channel.
enters the liver, the blood vessels branch off again within the liver. So they become smaller, and that is where the eggs get trapped
Okay.
as the vessels get smaller.
Okay.
Yes. So when they are trapped, you get a lot of injury around the eggs. They irritate the blood vessels. So there is inflammation. Each time it causes injury, it heals with scars until a point where there is extensive scar formation, and that narrows
within the blood vessels. This
within the
process is
blood
occurring in the
vessels
blood
or
vessels.
just around the blood vessels.
Around the
Yes.
liver.
Yes.
The blood vessels which are draining into the liver, those are called the portal vein.
veins. Yes.
So when the eggs are deposited along that
The
big
portal
vein, which
yes.
is entering the liver, it causes
Scarring.
scars
formation.
and injuries, and those scars are what obstruct the blood flow.
Yes.
And
So you get narrowing of that big vessel, and so you still get flooding. You get increased pressures, back pressure
Okay.
in those blood vessels.
So these worms, they cause a lot of so the worms, they per se just produce the eggs, and the eggs are what cause
It's
the
the
problems.
eggs that cause most of the problems.
They cause also the problems. So are there ways in which, are there some people who are at risk of getting this worm infection?
Yes, because
now that we know they like to live in water.
So because a very important part of their life cycle is in the snail, which lives in fresh water. So persons who live near water bodies are actually at risk.
Okay.
So in Uganda, people who live along River Nile, and those who live near Lake Albert. So Lake Albert is the hotspot.
It's a hotspot.
Yes.
Okay.
For Bilharzia. Yes.
So,
and so these symptoms are very common in the population.
How about
around
Lake
the lake.
Victoria? People like to go to Gaba Beach.
Yes, Lake Victoria also has not as much as Albert, but it has. So it's not only the big water bodies, sometimes even swamps, as long as it has fresh water.
And there
can
are
have.
snails
So
in
people who do farming in swamps are also at risk.
Okay.
So in most cases, we have fishermen, then the population that lives around the rivers and lakes, because their livelihood revolves so much around the lake.
Okay.
Most times they will go fishing, they will draw water from the lake for domestic use, so they get exposed to the water and may get infected.
After the break, we'll come back to understand if there are ways we can prevent ourselves from developing Bilharzia, because we know Bilharzia, this worm infection, 20, 30, 40 years down the road in your lifetime, you might develop big vessels that will present as massive bleeding or vomiting blood coming from the stomach. So how can we protect ourselves from getting Bilharzia? And if someone has Bilharzia, what should they do? Our gastroenterologist in the house will tell us more about this after the break.
You are watching the Doctalk Show.